Welcome everyone again to the University of New Mexico Law and Mental Health Didactics Series, hosted by the University of New Mexico Department of Psychiatry and Behavioral Sciences and the New Mexico Behavioral Health Services Division. We're so glad to have all of you joining us here again today. I'm Dr. Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico's Department of Psychiatry and Behavioral Sciences. Before we get started today, just a couple of heads ups on some things. If you have any questions for our presenter today, you'll enter them in the Q&A box anytime you feel comfortable. We do hold those until the end, and we try to get to as many as possible. Just forgive us if we can't get to yours. For those of you who want continuing education credits but are on a tight schedule, you do have to stay for the hour, but do not have to stay longer than that. We will let you know when the hour is passed. We may stay longer to address any questions that the audience has. For those pursuing continuing medical education credits, there will be a sign-in sheet in the chat box actually right now. And then in the last 5 minutes or so, will the link be posted for APA continuing education credits. Make sure if you're pursuing those to open your link before you exit the webinar today, and make sure you save your certificate after you complete the survey, because we don't have access to those. We don't have any copies of them. A recording and a PDF of the slides today will be available for those of you that have registered later today. And as a heads up for next week's talk in our series, we'll have Dr. Nicole Graham, who will be overviewing neuropsychology's role in forensic work. But now is what we've all been waiting for today. I'd like to introduce you to today's speaker. We'll be discussing a socio-ecological lens on police officer mental health and wellness. This is Dr. Kathleen Padilla. Dr. Padilla is an assistant professor in the School of Criminal Justice and Criminology at Texas State University. She received her Ph.D. from the School of Criminology and Criminal Justice at Arizona State University and completed a Post-Doctoral Research Fellowship in the School of Criminology and Criminal Justice at Arizona State University, during which she evaluated a police officer wellness program. Her work is focused on police officer mental health and wellness, police community relationships, and qualitative methodologies. Dr. Padilla's research has been published in Occupational Medicine, Psychology, Public Policy and Law, Justice Evaluation Journal, and the Journal of Experimental Criminology. Dr. Padilla, Kathleen, on behalf of the University of New Mexico, can I say we're very excited to have you joining our series and are very thankful for you to share your expertise with us today. I'm going to now turn it over to you.
Awesome, thank you. Go ahead and share my screen here. All righty, so thank you all for being here today. As Dr. Perillo mentioned, my name is Kathleen Padilla. I'm an assistant professor at Texas State. I want to thank everybody at UNM for inviting me out to talk. My discussion today is going to be on understanding police officer mental health and wellness, and in particular, kind of focusing on this interdisciplinary social ecological approach to the study. There we go. So before we kind of get into the meat and potatoes really of my talk today, I did want to provide a little bit of background, who I am, how I got here, and my positionality related to the topic. So I have never been a sworn police officer, but I did grow up around a police department. So I spent a lot of time in my childhood wandering around the local police department where I had family that worked and still continues to work there. So I received my bachelor's of criminal justice from the other New Mexico institution, New Mexico State, in 2014. While I was there, I interned at that local police department in the criminal investigation section. I then continued on to Arizona State for my master's, Ph.D., and postdoctoral research work, all of which focused on police officer mental health and wellness. And I returned back to my local PD to conduct that research for my master's thesis and doctoral dissertation. Now, while I was at Arizona State, I was able to help form and work in the youth justice lab. So I was exposed to another aspect, another dimension of the officer working environment, how they interact with kids in the community in particular. And all of that work has continued in my new position here at Texas State. So I am still involved in understanding the different aspects and dimensions of the work officer or the working environment for police officers, particularly right now looking at recruitment and retention of female officers. But all this is to say that I don't come from a law enforcement background myself. But my position as a familial member of law enforcement officers, having spent a lot of time there, kind of formed the foundation for this research. So we'll go ahead and jump right in. 2020 really was a turning point in terms of what was occurring nationwide and worldwide, right? First from the worldwide pandemic and quarantine, followed by kind of the revolutions demanding police reform after the murder of George Floyd. The occupation of policing really has become more complex, and officers are under a lot more scrutiny than they have been in the past. Now, the Officer Down Memorial page reports that from 2020 to 2022, so that last full year of data collection, 1,335 officers died in the line of duty. Now, most of those were related to COVID, but approximately 180 of those were related to accidental or intentional gunfire. What we don't see in databases like the ODMP are deaths by suicide, and there are a number of reasons for that. Including a department's desire to shield the officer, their families, and even the department themselves from a lot of the stigma that's still associated with mental health concerns and suicide. Now, the Blue Help organization, which has been collecting records and data of officer deaths by suicide since 2016, does report that in that same time span, that 2020 to 2022 time span, 504 officers died by suicide. Now, more officer deaths by suicide than by accidental or felonious homicide is not a recent trend, so it's not limited to those 2-year periods, but it is a trend that we have seen since these data started being collected. So this is all to say that right now, worldwide, really, we really need to be paying attention to the working environment and mental health outcomes of the officers that are patrolling our streets. This is not to say, however, that abuses of power and inappropriate use of force could be or should be justified by the potential for poor mental health. It's really just one of many factors that we need to take into consideration when we look at the field of policing and are looking for ways that we can help improve it. Now, I do want to start with a quick discussion about stress as I conceptualize it. So I typically use a kind of an interdisciplinary approach to addressing stress in this population. That includes, right, biology and medicine, psychology, and then criminology, which is my home field. But at its most basic level, right, stress can be defined as the non-specific response of the body to any demand made upon it. Now that can seemingly be applied to just about everything, anything and everything really. And so the way that stress is operationalized and conceptualized really depends on the field in which you're studying. Now, when we look at it from a biological or medical perspective, stress is often examined as a process of hormonal or other physiological responses to a situation. So emphasized here is the perceived unpredictability or uncontrollability of any given situation. And the endocrine system, and in particular, the hypothalamus pituitary adrenal axis, that HPA, is a system that's most strongly associated with the stress response. And certainly some level of stress is healthy for the human body, but the overactivation of these responses, such as the overactivation of that fight or flight response, can lead to the impairment or destruction of neurons, which is what can be seen in individuals that have PTSD or clinical depression. Now, when we look at it from kind of a psychological lens, stress is often examined as it relates to an individual's ability to cope with stress and really ensuring that they have the right tools to manage whatever stress they may be encountering. So adaptive or pro-social coping really refers to methods of coping that are associated with decreases in psychological distress. So looking at ways to fix the problem head on. So this can look like things like going to see a counselor or talking with a therapist. Maladaptive coping, on the other hand, really refers to methods of coping that are designed to help somebody avoid dealing with that stress, which really just leads to further psychological distress. So this can include engaging in alcohol or drug use, really to kind of depress that stressor and that reaction to it. Now, when we look at it from a criminological lens, rather than being conceptualized as this dependent variable or this outcome, we often refer to it as strain, right? Referring to Robert Agnew's general strain theory. And we look at it as an independent variable or a precursor to crime or crime analogous behaviors. So where psychology discusses the subjective evaluation of one's ability to manage stress, criminology looks at that behavior as a result of attempting to manage stress in crime or crime analogous ways. Now, Robert Agnew's theory has a ton of components to it, but some of the important ones for our purposes here are the discussion of objective versus subjective strains. So objective strains are strains that or stressors that can be considered stressful by a majority of the population, right? So the pandemic that we all are, right, still in the process of, that was stressful for everybody. We can generally agree that that was a very stressful process to go through. And subjective strains, on the other hand, are stressors or strains that are impactful really to that specific person. So somebody who has, say, for example, a fear of public speaking, that is a very specific type of stressor that's likely to impact that person in particular. Additionally, Agnew discusses experienced, anticipated, and vicarious strains. So strains are stressors that you personally experience, that you anticipate to experience in the future, or that you have seen experienced by people around you. Now, that was a lot of information, but the easiest way really to kind of look at stress from the holistic way that I'd like to, sorry, that's my service pup, is really to use an example. And so it seems appropriate to use the example of giving a presentation as a situation that somebody might find themselves in that could kind of set off this stress process. So if somebody finds out they're giving a presentation, they might start going through these, or might start having these physiological reactions. So their heart rate might start increasing. They might feel blood rushing to their face. This then leads oftentimes to psychological reactions such as anxiety, potentially fear. Now, these two components often act in a feedback loop wherein one impacts the other. So that anxiety can often lead to a sustained increased heart rate, which then leads to sustained anxiety, right? And all of this may lead this individual to react in a maladaptive or an adaptive or pro-social way. So if they're looking at it in a very pro-social way, maybe they're going to have a walk, playing with their pet, right? Or they might go have a beverage, right? To literally depress some of those physiological responses that they have occurring. Now, when we look at this in terms of policing, in order to connect it to policing, we have to discuss the President's Task Force on 21st Century Policing. So in 2015, after a series of high-profile police use of force incidents against predominantly minority men, President Obama convened a task force that was designed really to just improve policing in America. And there were 6 pillars included in this task force report, looking at ways to improve trust and legitimacy, technology, things like that. And one specific pillar focused on officer wellness and looking at that through stress reduction. Now, when we look at stress in policing in particular, right, so we've covered kind of very briefly, of course, the biological and medical approach, the psychological approach, and the criminological approach. When we look at these sources of stress in the field of policing in particular, traditionally, scholars have argued that they stem from one of 2 sources mainly, organizational and operational or occupational. You'll see them discussed as both. So organizational sources of stress are those that are shared with other occupations. They are not job specific. They include things like dealing with excessive paperwork or an unsupportive supervisor, things like that. Now, in policing, these types of stressors are typically noted as being more impactful, more distressing, more prominent in the lives of police officers, presumably because they are less expected compared to some of the operational aspects of the job. So when we're looking at operational or occupational sources of stress, these are job specific. So these are inherent to a particular occupation, in this case, inherent to being a police officer. So this can include scenarios such as critical incident exposure, traffic duties, shift work. And while it is important to note that shift work isn't solely reserved to folks that work in policing, right? If you work in the medical field, you do deal with this type of shift work as well. But for police officers, it is considered one of the more potentially damaging or consequential sources of stress for officers. Now, more recently, this kind of third discussion or source of stress, which really is a branch off of these operational or occupational stressors, is the psychosocial metrics. So this can include things like increased public media scrutiny, the fear of police citizen encounters surfacing online, right, as they have been occurring with improvements in technology and things like that, as well as just kind of an inherent fear for your or your family's safety simply as a result of you being a police officer. Now, I argue really that we need to be looking at these stressors, these sources of stress from a more holistic viewpoint, right? And really, I argue that we need to be pulling more from Bronfenbrenner's ecological systems theory. So, of course, this was initially, or is predominantly rather, used to explain juvenile development and delinquency. Right, I was exposed to this during my time at Arizona State, and I have not been able to stop applying it to the work of police officer mental health and wellness. But really, it's looking at all of the environments that a child, or in this case, an officer, is situated in, and looking at how those interact with one another. So when we think about the typical stressors felt by law enforcement officers, we're typically doing so in a silo. So we're looking at how job stress affects job performance, or maybe how job stress is affecting familial interactions. But rarely we look at how these different environments are actually impacting one another and how they're interacting with one another to create this whole picture of officer wellness. So when we think about these systems in particular in the lens of policing, it's fairly easy, right? So we have the police officer themselves. Their microsystem would be their families, their coworkers, the citizens they interact with pretty regularly. Their mesosystem would be the interactions between all of those groups. So how their coworkers interact with their family, how they view their coworkers interacting with citizens, things like that. Their exosystem would involve then other aspects of the criminal justice system, perhaps politicians, legislatures, things that directly impact their job, though they may not have a direct interaction or connection to those people or those actors. The macro system, right, those social and cultural values. We all know the phrase about the thin blue line, right? So that culture that is enmeshed in policing for sure, but also the broader societal cultures. And this becomes in particular important when we're looking at ethno-racial minority officers who might come from a background and a culture that might be at odds or somewhat inconsistent with the culture of policing. And then finally, when we're looking at that chronos system, everything that I discussed at the onset of this talk, really that has been occurring since the 2014 death of Michael Brown, these substantial changes in perceptions of law enforcement, how officers themselves are perceiving their jobs, all of these things are, of course, impacting the way that officers do their job and all of these other smaller systems. So my argument really is that we need to be looking at the police officer as a whole human rather than simply as their uniform. Now I'll move into a quick discussion here about some of the consequences of stress in policing, right? Just as sources of stress can vary and come from a variety of sources, the consequences of this stress can manifest in a variety of dimensions of an officer's life. So psychologically, officers have relatively high rates of anxiety, PTSD, suicidal ideation, and suicide. Physiologically, officers have relatively high rates of cardiovascular disease, oftentimes due to improper diets or insufficiently healthy diets, deaths due to liver disease, as well as things like insomnia or chronic pain issues. Behaviorally, officers can have relatively high rates of alcohol or drug use, divorce, domestic violence, and neglect. And all of these things are important in and of themselves, but they all also have an impact on the organization. So what does improperly managed stress look like for the organization, right? In addition to the recruitment and retention crisis that we're currently seeing across the country, right? We have decreased job satisfaction, increased turnover, absenteeism, and of particular interest is use of force. Now, we know that the rates of, or the prevalence of use of force is relatively low, but an officer who is under a lot of stress or who may be extremely fatigued due to shift work may be less likely to consider all available alternatives before resorting to force. And so all of these things make it really apparent that it behooves the organization themselves really to take steps to appropriately manage their employees' mental health and provide the resources and create a culture that's supportive of those resources. Now, an additional consequence here, or rather, perhaps even just a separate source, is this perception that officers are under attack at higher rates than before. And certainly we have seen instances of officers being ambushed and attacked and killed just during, the normal day-to-day course of their duties. But alluding back to those numbers that I provided at the onset, so just over 1,300 officers died in the line of duty from 2020 to 2022, with about 180 of those being related to gunfire. So certainly the risks of dying in the line of duty are real, but oftentimes the more imminent danger is when we look at those numbers for officer suicides, right? Those 504 officers that have died by suicide in that same time frame. And certainly when we're looking at these numbers, officer deaths by suicide, aside from COVID, tend to be one of the driving factors in total officer death rates. And there are a number of explanations for why officers might have higher suicide rates compared to other populations, namely their access, the ease of access to a lethal weapon can play a role. Additionally, as was discussed in the consequences of stress, alcohol and alcohol-related issues are discussed a lot. And a lot of that has to do with the socialization and the acceptance really of alcohol as a proper coping tool among this population. Now, what can we do about this, or what has been done, what is being done? Oftentimes officers are relatively limited in terms of the types of services that are offered. Certainly a lot of departments are making great strides in terms of the support and resources that they provide. But initially, officers will go through a psychological entrance evaluation, really to determine if they possess the skills necessary to manage the stress of the job. Now, it is important to note here that there really isn't much standardization across the country in terms of the evaluation tools that are being used. So what we are looking for, what we're trying to screen out, isn't always universal. So that is important to note there. Additionally, and this is perhaps the most daunting interaction that an officer might have with a psychologist or a psychiatrist, would be in a fitness for duty evaluation. So this would happen after a critical incident of whatever that department deems a critical incident. And this really is just to ensure that this officer is ready to return back to the job. So this can be one of the more, like I said, daunting interactions between an officer and a psychologist. Departments may also offer an employee assistance program. This is one of the most commonly provided services, and this typically involves the use of like an in-house or a contract psychologist. This service oftentimes is free for the officer and their family to utilize, but there still remains a level of skepticism here, right, where officers oftentimes will think that there is not this patient confidentiality aspect taken into consideration. So while this person might not be reporting everything back to the department, they still work for the department. So there can be this level of skepticism and lack of trust there. A lot of agencies are moving towards using peer support groups, and just one example of that is the Cop to Cop program in New Jersey, which employs retired law enforcement officers that basically kind of sit at this hotline for officers who are going through issues that need to talk to somebody who is external from the department, but understands what they have gone through. And then finally, departments can offer any number of kind of in-house trainings on resiliency, emotional survival, things like that. But these services are neither mandated for the most part. And there's often this perception that they're not particularly supported by either the administration in the department or by their peers. Now, when we look at what the research tells us for mental health interventions in or wellness rather interventions in policing. There have been a couple of reviews on this topic, and typically these interventions, these programs are looking to address one of these three areas. So either psychological issues, physiological issues, or behavioral issues as a result of some kind of mental health crisis or something like that. But arguably most of these interventions are reporting minor positive or null results. And really these interventions need to be kind of tackling all of these issues together. So again, taking that holistic approach, looking at their mind, body, and actions, right? And that typically will result in higher or more significant results and progress and improvements that way. Additionally, a lot of these interventions will occur kind of at this secondary phase. So interventions can occur at one of three phases. Those that are targeting at the primary level are aiming to prevent that source of stress. So these are preventative in nature. They're working to stop stress from occurring altogether, which is very difficult to do, as we'll get into. Secondary interventions are aiming to be more ameliorative in nature and help individuals cope with the stress that has already occurred. And then finally, tertiary interventions are reactive in nature. So they're trying to treat the stress-related symptoms that are already showing. Now, when we go back to our example, right, of giving a presentation, we have this stress process. It can result in either this maladaptive or pro-social method of coping. Most of the interventions, rather, that are taking place are looking to target this reaction, this process that's occurring altogether, right? So that looks like when we're teaching breathing exercises, mindfulness-based training to prepare them for going into that situation. So before giving a presentation, perhaps I'm sitting here taking deep breaths, kind of trying to get into a nice Zen mode to reduce those physiological reactions. Interventions are occurring kind of at that tertiary level as well. So really trying to fix our responses. So I give a presentation, I might have my anxiety attack or my panic attack, right? And then what do I do next? That's kind of what is aiming to be addressed there. Very rarely do we look at reducing the source of the stress itself. Right. And it's totally understandable. Stress is very subjective, as I was discussing, right? It's very individualistic and it's very hard to change. And because a certain level of stress is healthy for the body, you don't want to eliminate that altogether. So most of these interventions that we're looking at are focusing on these later stages of the stress process. Now, when we look at these mental health care services, barriers to accessing these can occur for a variety of reasons, similar to the sources of stress and consequences themselves, but largely they can be categorized into two different groups. So barriers can be fear-based, right? So officers can be afraid of losing their job, of having their weapon taken away. They can be afraid of their peers or supervisors or subordinates finding out. And then there can just be this self-imposed stigma that admitting you need help makes you weak, right? And so these all require a larger cultural change in how mental health care services are advertised and such to law enforcement agencies and officers. Additionally, barriers can be resource-based. So resources might simply be scarce, they may be inadequate, or they might not be easily known or accessible. So you might have the most wonderful mental health service program or intervention in the world, but if your officers don't know about it or how to access it, then they cannot utilize it, right? And so I want to provide some context for kind of that whole body of literature that I have been enveloped in for the last decade or so. And the projects that I'm going to discuss here are part of a series of projects and partnerships in conjunction with the Las Cruces Police Department. So I'm very thankful that they have allowed me to work with them on such a sensitive topic to help provide and aim for providing some meaningful policy changes. So quick timeline of what this research partnership looks like. You'll notice here, right, the different police chief appointments. We know that 3 to 5 year time range is typical for police chief tenure. So there's a lot of turnover at that top ranked position. So back in 2014, a police chief was appointed. I then went in to conduct these, what I've termed time one surveys, which formed the basis for my master's thesis. And then these time one interviews that were just an additional project during my doctoral program. And I'm happy to discuss those interview and survey tools with you all if you have questions about them. In 2018, in 2018, a new police chief was appointed. So I conducted, again, these what I've termed time two surveys and interviews. So this formed the basis for my doctoral dissertation. And as I mentioned, right, on the very similar topic, so about stress and wellness and resources and things like that, but under new leadership. So kind of looking to see what impact that might have had. Now, in November of 2020, another police chief was appointed there. And so this has kind of set the stage. We're in process of conducting what will be deemed time three surveys and interviews. Again, just looking at how these topics might be changing under leadership, kind of what this looks like for this department. So kind of a longitudinal case study approach. Now, the first project that I'll talk about in a little bit more detail is these 2015 time one surveys. So this results in the publication in Occupational Medicine. This really was just using the police stress survey, Spielberger and colleagues police stress survey, which provides scenarios that an officer might find themselves in, and then it asks them to kind of give a score of stress severity for those. So this was looking at sources of stress, willingness to access services, knowledge of services, and things like that. And some of the key findings here were that occupational or those operational stressors were rated higher or more prominent and distressing than organizational stressors. Now, this is completely counter to the literature here, but it could be argued, right, that at this time for this department, being a police officer was more stressful than simply being a member of a bureaucratic organization. Additionally, there was significant variation by race and ethnicity. It's important to know that this department is predominantly Hispanic. The city in which it resides is predominantly Hispanic. So it is a very ethno-racially diverse department and city. And even still, ethno-racial minority officers were reporting higher levels of stress than their white officer counterparts. And then the last kind of key finding here is that a majority of these officers indicated a willingness to access mental health care services. Now, this again was completely counter to what the literature would tell us, right? We have those concepts of machismo and what that looks like in one in the policing culture, but also in a lot of Hispanic cultures. So being able to see that a lot of these officers were willing to access services was quite surprising. The second study that I'll briefly cover here is these 2016 kind of time one interviews. So these were interviews that were conducted with members of the criminal investigation section, results in the publication Police Practice and Research. And what I really wanted to know here was, what does stress look like for this very specialized population, right? They deal with different things than patrol officers do. So what does stress look like here? How do they deal with it? What could the department be doing? And so this was a replication study. All of that information can be found in the article, which I'm happy to share. But so these are all just one-on-one interviews with members of this section. And a couple of the key notes here were kind of a universally reported sense of helplessness, right? In particular in helping these victims and families' victims. So not being able to do enough for the case, not being able to devote enough time, not being able to provide the right justice that they thought that the victims and the victims' families deserved. An additional stressor that was really highlighted here was increased exposure to death or injuries, right? Where a patrol officer might set up a crime scene, right? Make sure that's secured. They then might leave to go answer another call, but the detective and the investigator that is dealing with that case sees it from the onset all the way through, hopefully, the conclusion. So they're seeing a lot more trauma than what the patrol officers would be seeing, because they're seeing it repeatedly. And this leads to the last kind of key note here, is this notion of increased interactions and really frustrations with the court system, right? So officers and investigators who had put so much of their time into putting together a really solid case, the case might not move forward for whatever reason, or the prosecutor might let it result in a plea deal, or something else could happen that leads to a lot of frustrations with members of this population. And so the kind of overarching idea here is that we cannot be simply looking at patrol officers and what they find stressful and then generalizing to the rest of the employees there, right? Folks that work in these specialized units, they have specialized needs, and this would be true for officers that work in metro narcotics, that work undercover. SROs deal with school resource officers deal with things that are vastly different from kind of the standard patrol officer. So that was kind of the big takeaway there. And then the last piece that I'll discuss here to provide kind of some context with this work results from these 2019 kind of Time 2 surveys. So this formed the basis for my doctoral dissertation. One of the articles that's come out of it is in press at Journal of Police and Criminal Psychology. That study is just descriptive in nature, but the study overall provided a lot of really rich, great insights into what was happening at this department. So, right, as I mentioned, the 2015 surveys had one police chief. It was 2019, they had a new one. So at this department, stress had shifted from those 2015 surveys. So, 4 years previously, they were discussing that being a cop was more stressful than the organization. That had switched back. So it was more in line with what the traditional literature would tell us. The organization itself was now more stressful, more distressing, and more prominent in the lives of these officers. And arguably, it could be, the change in leadership took some adjustment, right? That's one potential explanation. Alternatively, they might be desensitized to some of the stressors associated with being a police officer, right? It's important that this was a full year before George Floyd and kind of the summer of protests. So what that stress looks like today or in the immediate aftermath of the George Floyd incident remains to be seen. But being a police officer now might be less stressful, or at least it was in the 2019 iteration here. Additionally, still a majority of officers were willing to participate in services, but there was a catch here. So I included more specific questions. When officers were asked if they were willing to participate in general mental health services, about 40% said yes, which still was, more than I was anticipating. But whenever I asked more specifically if they would be willing to participate in a mental health checkup, kind of like a physical checkup, or a mental health class, those numbers jumped to about 2/3, indicating yes. So what this says to me is that not only is it important that our officers know about the services that we are providing, they also need to be advertised in a way that is most beneficial to them, right? So general mental health care services might have this punitive, potentially reactive component or connotation to it, where they might associate it with potentially losing their job. Whereas if it's another class or a checkup, something that they can add to their tool belt, then it's more informative, it's proactive, it's not seeking to cause anybody to, it's not a gotcha moment for these officers. So that was a really important finding here. And then the last kind of key finding for this set of surveys was that organizational procedural justice might be a way to continue to improve or increase willingness to access services. So I utilized a survey that was looking at officers' perceptions of their administration, right? Do they treat you with respect? Is there transparency in the decision-making process? Do you have a voice? All of those things that are really crucial in the procedural justice model. And officers that had better perceptions of their administration on this scale were more likely to report a willingness to access mental health services. So if they trusted their administration, they're more likely to seek help. Right, and that's a really easy, really cost-efficient way to ensure that your officers are seeking help when they need it. Now, why does this matter? Why does this work matter? I want to bring you back to this this graph that I showed earlier. Beyond simply increasing or improving mental health for the sake of improving mental health, right? Beyond potentially saving lives for the sake of saving lives, mental health issues among police officers and law enforcement officials is a public health concern. It is a public safety issue, right? If our officers are not healthy mentally, then we cannot expect them to be in the right frame of mind to be interacting with citizens in the best possible way. So if we want to make sure that our communities are safe, that our communities have good relationships with law enforcement, we need to make sure that we are starting at home and making sure that our officers are taken care of. And so with that, I want to say thank you and open it up for any questions.
Thank you so much, Dr. Padilla, for very thorough and detailed mapping away of these different ways that that officer wellness is relevant today and the ways that we can address it. I do see we have a number of questions here. In the meantime, of course, anybody that has additional questions, go ahead and throw them into the Q&A box. We'll do the best we can to get to as many of these for the next 15 minutes or so. One question that I see here is regarding psychological entrance exams. It says, do you think agencies are skimping on the psychological entrance exams in light of recruitment and retention crisis issues? And if so, how does this impact current officers' morale, knowing officers who shouldn't be on the job are passing?
That is an excellent question. Thank you, Jessica, for that. So we have seen that they are a lot of agencies, or some agencies rather, I'll clarify that. Some agencies are adjusting their eligibility requirements, lowering the age. There's discussion of kind of shifting the academy length and stuff like that around just to get more bodies on the street. I have seen less about them kind of skimping on this crucial aspect for the entrance evaluations. But I would imagine that they might be, there's the potential for them to be a little bit more lenient, right? A lot of folks that conduct these entrance evaluations are looking more for the big red flags of folks to screen out, rather than kind of looking for some other qualities to screen people in. So they might be getting a little bit more lax in terms of what they would consider a qualifier to screen somebody out, would be my guess. But until we actually kind of hear from agencies about how their entrance evaluations are shifting, then that's really kind of unknown.
If an officer asked you, what could going to therapy do for me? How would you respond? We know the why of mental health, but what about the hook to bring them in, the what's in it for me question?
So I'll respond to that kind of with an anecdote, right? So some of the work that I've been doing now, evaluating an officer wellness program, a lot of these officers were near or closer to retirement, so later on in their career, when they started actively seeking out these services. And they did it for a very unique reason. A lot of folks discussed wanting to reset who they are. So they wanted to be who they were before they joined the force. And so by that, they meant they wanted to have better relationships with their friends, with their family, maybe their patients. They've become a little cynical. All of these things that we know can happen the longer you're a police officer. So I would say, why should folks go to therapy, or what can it do for them? It can help kind of get you back to who you were, help give you tools to manage what you're seeing so that it does not impact the rest of your life, if that makes sense.
Certainly. Thank you for that.
Yeah.
We have another question here that prefaces, thank you for addressing a much needed topic. Follows on, how might therapeutic interventions for police officers be integrated into the training process throughout their careers?
Awesome question. I would argue that it absolutely needs to be integrated throughout the duration of their career. So a lot of academies will have a certain block of time set aside for kind of managing your own mental health and resiliency and things like that. But it's not always something that is repeated throughout the career. So I've had this discussion with my class about how we could be incorporating this kind of training into an officer's career. And, there are different exams and, different trainings that they have to go through regularly. So I would argue that we just kind of add that in, right? It's a tool. It's something that you have to continue using in order to be most efficient at using those tools. So whether that looks like, once a year or every other year or something like that, when they're having, any type of physical health checkup or anything like that, adding in this psychological component, just kind of assessing like, hey, how are you? Where are you at? But doing it in a way that's not necessarily intrusive and does not have that connotation of you might get fired if you give the wrong answer, right? We want officers to be honest with how they are doing, even if that's not doing super well. So if we can provide the support for them to be open about those things in an honest way, then I think that would help.
Yeah, we had a related question about, are there any protocols in place for routine evaluations at intervals to assess? And it seems like you've addressed that right here, is the fact that we don't. We tend to have this very front end approach to assessment when people enter the door, less so throughout their careers.
Yeah, that's what it seems. And certainly I'm sure there are some agencies that are taking steps to make it a more kind of rigorous and repeated assessment. But, those are just a few agencies likely.
Yeah. Another person asked, with time constraints and difficulties covering shifts, et cetera, what would you find is the most valuable resource to assist officers in addition to the culture shift, trust of administration that you had mentioned?
That's a really great question and a really great point, right? We know we have a staffing crisis right now. With budget cuts, oftentimes training is the first thing that gets cut, which really it shouldn't be, right? We want more training for officers, more tools for them to have. So in cases like this, how could we integrate that, knowing kind of those issues? The easiest way really, I think, would have to be kind of just that change in interactions between higher ups and those that work for them. So that kind of procedural justice account there, right? If we're getting better training for our chiefs and stuff, and upper middle management and things like that, then that really kind of takes away the need for officers to be taking time off for additional training. So I'm not sure that really answers that question, but I'm not sure that I have a very clear way of how that could be practically implemented.
Sure. As you can tell, we've got a lot of people that are asking some really big picture questions of how we can approach this. I'm gonna shift gears slightly because it seems like you're also getting a lot of questions specifically about some of the studies of your own work that you've mentioned. Somebody mentioned you mentioned variation on, I believe it was some mental health issues based on race and ethnicity, and this person was curious if you saw any variations based on gender.
Okay, excellent question. In my studies themselves, that department is pretty, or at least at the times of data collection, we're well below the national average for female representation. So I think right now we're about 13% of police officers are female. In this department, it was, I think, like 8 or 9%. So there wasn't much of a sample size there to do meaningful comparisons between male and female officers. But I can speak to kind of what we see in the literature, which typically indicates that female officers have different sources of stress. So their stress levels might be about the same, but they're coming from very different sources. So obviously experiences of sexism or harassment can lead to that. But also there's the added component of a lot of female officers also being caregivers, having kids at home, so having to manage that, managing the difficulties of working in that profession while, maybe being pregnant, being on maternity leave, having kids at home. So the sources of stress for women and female officers in general tend to just be a little bit different. But their source or their levels of stress, rather, at least in previous literature, has been pretty comparable.
Excellent, thank you. Somebody asked, following your Las Cruces study, that while a majority indicated a willingness to access services, do you know how many actually did? Was there an increase in service utilization noted?
Also an awesome question. I'm not sure, but that is an important aspect to keep in mind, right? Attitudes and behaviors are very different things. So certainly it would be beneficial to go back and look through, who actually is taking the opportunity to access these services. But I will note all of these surveys were entirely non-identifiable. When I initially did the first round of survey collection, I didn't anticipate doing longitudinal stuff, so I didn't include any measure of participant identification there. So there would be no way for me to know, hey, this person said yes, did they actually go do it? But definitely kind of just general increases might be beneficial to know.
And speaking of that unintentional longitudinal time frame there, somebody said that you noted that you're working on a time 3. Do you anticipate changes in officers' responses at time 3 as you saw in times 1 and 2?
I would, but I will kind of caveat that with saying, if I were to collect these data, like fall of 2020 versus spring of 2023, I think those would be giving vastly different responses anyways. So I'll speak to, if I collected data now, I think the results might be somewhat similar, if only because of this kind of desensitization to everything that's going on nationwide in regards to perceptions of being a police officer, potential dangers and risks associated and things like that. So if they were being collected, right now, spring of 2023, then I would anticipate that they would be more similar to the 2019 surveys. If they were collected closer in proximity to George Floyd's death, then I would anticipate that they would be vastly different in terms of those sources.
And then I guess a bit more of a meta advice kind of question, given all your studies in these areas, is somebody asked, what do you suggest a researcher do to gain access to data collection with a police population?
That is a really important question, and I try to get other folks who work with agencies to offer advice too. So this agency in particular, I do have a very unique access to it, right? I know a lot of these officers, although more of them are kind of higher ups now or retired already. But I know them and I have spent time at the department. So they knew my face as being somebody who was in enough so that I could understand what they were talking about, but not so in that they couldn't trust me. So I was able to leverage kind of my in-out positionality in regards to this specific police department. As far as new agencies and new departments, the best advice kind of that I could give for getting involved with an agency is really just to approach either, the chief or somebody who's involved, if they have a research and development unit there, approach them, introduce yourself and say, what is it that your department needs help with? Or what could I help with? Or what are you trying to figure out? Things like that. Approaching it from a what can I do for you versus what data can you give me that will give me publications, right? That's not the right approach that you want to take with particularly police agencies. So it's like, what can I do for you and how can we help each other and help solve whatever problem it is that you might have. So that would be the advice that I would give. It's kind of the approach that I've taken with meeting new agencies out here in the Texas area. Right, it's just reaching out and saying, this is my experience, this is what I've done before, this is what I could do for you. Would any of this be useful?
Very helpful information for people out there that might want to contribute to this field. You've answered so many. I'll just ask a couple more that seem to get to these some of the obstacles to mental health wellness programs and outreach and all that before we wrap up here. Somebody asks, how do you balance advocating for required mental wellness training and pushback from unions? Unions can undermine even the best intentioned ideas if they don't understand the intent behind it.
Right. Yeah, I see a couple questions here kind of related to unions. And certainly the one of the original overarching goals for police unions was to provide protections for their job, make sure that officers have safe work environments, that they have everything that they need. So, how I would balance that would be, this is the best way to keep our officers working for longer. If we can make sure they're healthy, that they are taking care of themselves, then they can be working for longer. Then they can have better job security, more job satisfaction. So I think for the police union aspect, because of course, they can be barriers to any type of training. So it would take a different kind of approach or different way to approach that topic. But if you just look at it kind of larger scale, like healthier officers can work more and they can work better, or not more, they can work longer and they can work better if they are healthy. So I would approach it kind of that way, but I don't have too much experience actually interacting with folks that are kind of running police unions, but certainly it's an important aspect to be taking into account.
And then that more personal aspect of a potential barrier, somebody asks, what might privacy boundaries be in departments so that a therapist, whether in-house or coming in to consult, does not impact career paths? Or similarly, what do consulting therapists have to report or may maintain with confidentiality to or from the department?
Awesome question. So as far as I know, they only have to report very similarly to kind of a standard like psychologist or psychiatrist if there is the potential for harm, either self or other. But one way that agencies have kind of worked with this is offering the ability for officers to seek their own outside psychologist or psychiatrist. So they can see the EAP, or they can use, their health insurance to work with somebody outside of the department if they don't want it to be intrinsically linked in any capacity. But again, they would have very similar, I believe it was, kind of reporting requirements that any other psychologist or psychiatrist would have.
And I'll throw one last question here as we're reaching the top of the hour here. Based on your research and experiences interacting with police officers, can you talk a little more about police officers' understanding of race, racism, and culture, and how understanding of this system of oppression or lack of understanding might impact their wellness, mental health, or their readiness to serve?
Wow, that is a big question. So when officers go through the academy, they are, at least in most academies, given some historical context to policing, historical context to the criminal justice system. How well that curriculum accurately portrays the role of police is a whole different question, right? We see that in any criminal justice class, right? How the history of policing is portrayed may not be entirely accurate in textbooks, so folks may not be being taught kind of the whole story that way. So that's a completely separate question. But in regards to how understanding or lack of understanding of the history and the role of policing in America, how that might impact their well-being and their mental health, I think you would see it more often in folks from ethno-racial communities who become police officers. So when I've spoken with a lot of Hispanic police officers, their reason for joining the force is to make a change and to help make a change from the inside. So understanding how, their experiences, vicarious and otherwise, have impacted them growing up, and then wanting to join the force to kind of make some changes internally that way. But certainly, as we see, ethno-racial minority officers have higher levels of stress, right? Their status as a minority impacts that severely. So it certainly would, has an impact that way. But as far as, how that could be alleviated or how they could be taught or instructed, that's a whole other question.
Dr. Padilla, Kathleen, thank you so much for not just the wealth of information you're sharing here, but being able to zoom in and out here, talking about some really important big picture issues in officer wellness, and then zooming in on some of the nitty gritty of how we can actually develop these programs and execute them in ways that there would be buy-in. So really appreciate you coming in today and sharing this information with the LMH audience.
Absolutely. Thank you so much for having me.
Wonderful. That wraps up this week's Law and Mental Health series. As I mentioned before, next week we'll have Dr. Nicole Graham talking about neuropsychology and forensic evaluations. Have a fantastic rest of the day, and we will see you next time.